The purpose of this video is to teach you how to bolster, otherwise known as using pillows to support the hips and the legs when positioning your client on their side when you're doing tasks like changing a brief. Hi Millie, I'm going to be turning you on your side and I'm going to be using some pillows. So I'm going to start by going around to the other side and start to move you around. Normally you would pull up the side rail on their bed if they have a hospital bed, so when you turn them they don't go rolling off the bed. So you always want to raise the bed up to waist level to save your back from injury. Normally you would use the buttons on an electric bed. This bed we have a crank, it's a manual, so I'm going to do that. So you're going to take your first pillow before you roll your client on their side, and you're going to have them hug it. This ensures that when they roll on their side, this arm isn't in the way, and this supports them so they don't go onto their stomach completely. Then you're going to take the drop sheet or the pad, and you're going to pull them over as close to the edge as possible. If they're super stiff, you're going to take the second pillow and you're going to slip it between their legs. Now most of the clients that are bedbound are really stiff because their ligaments and muscles are really tight from not being used and being so old. So you're going to want to try to just finagle it, and pillows are soft so it's easy to do, and have a little bit of it underneath. So then you're going to tell your client, I'm going to roll you on 3. So Millie, I'm going to roll you on your side on 3. Ready? 1, 2, 3. And then you're going to hold them and see if they're going to be supported this way. Otherwise, you're going to take the third pillow and you're going to put it behind their back to support them. So you're going to come around to the front of them and you're going to make sure that this is about halfway in between their thigh and their calf, and you're going to want to make sure and try to get their knee and their hip as level and as equal as possible. Sometimes that's hard because the clients are really stiff and they're not very mobile, so do the best that you can. You're going to make sure this is all set, and you're going to make sure it's supported so that they can't roll on or off the bed. And then you're going to go about changing their brief or doing any kind of care on the back of them. When it comes to removing the pillows, you always want to be as gentle as possible. Don't just pull them out, because the sudden movement going back can actually hurt them. So when you're ready to move them back on their back, you're going to go back around to the other side of the bed. You're going to remove the support pillow from their back. You're going to pull them onto their back. You're going to gently remove the pillow, supporting the leg that's right here because it's lifted up a little bit higher than the other one. And then you're going to take the pillow that you're hugging from them. So you're going to pull the client back into center position. How does that feel, Millie? Are you comfortable?
Yes.
You're going to cover them back up. And then you're going to return the bed back into the lowest position. And that's how you bolster a client.